I'd like now to straighten the patient on the spine board. On your count, 3, 2, 1.
Welcome to my YouTube channel, and for our today's discussion will be on patient assessment skill, and our focus will be on trauma. And I know most of the EMTs or paramedics, this is one of your assessments that you should undergo or you should be tested on for you to qualify for the final exam. So it is very important for you to understand how to integrate the systematic approach and the management. So our today's discussion will be focusing on a scenario where we have a patient who has been rescued from a near drowning, and this patient is not responding.
Hi. Is she responding to pain?
Not responding to pain.
Okay. So what appears like threatening is that she fell in water. I'd like first to remove her wet clothes. I remove the wet clothes from her, and I'd like to dry my patient from any excess water that may have remained on her body, and cover her with a thermal blanket. Could you open the airway with the jaw closed? Okay. I'd like to assess if there's anything in her airway.
The air is clear.
The air is clear. I'd like to check her. Is there rise and fall of the chest?
There's rise and fall of the chest.
What's the RR of my patient?
RR is at 27.
At 27, I'd like to give her oxygen with an rebreather at a flow rate of 12 liters per minute. Okay. What's the quality of the pulse?
It's rapid and shallow.
Rapid and shallow.
Yes.
Okay. I'd like to check her skin condition. What's her skin condition?
Patient looks pale.
Pale. Is the temperature of the skin?
It's cold and clammy.
Cold and clammy. Okay. I've dried her and I've secured a thermal blanket. I'd like to proceed to do a rapid assessment of my patient. Okay, start to the head.
You realize there's a cut at that, and you can see some blood on your right hand.
Right. I'd like to take out a dressing and just put it there and secure it. Did the bleeding stop?
Bleeding stops.
I'd like to secure the cut on her head. Just don't move your hand, it's okay. I'd like to continue to palpate my patient.
Okay.
I'll move on to the neck. Can I see any tracheal deviation?
Trachea is intact.
Trachea is intact. Can I see any JVD on the chest?
No jugular vein distension.
I'd like to continue the palpation. No, I'd like to check her C spine.
There's a depression at C2.
At C2?
Yes.
And then I suspect she has difficulty with breathing. Can I want to reassess her RR again? What is her RR?
RR is at 26.
26?
Yes.
I'd continue the same flow rate of oxygen and continue my rapid assessment. The clavicle?
The clavicle is intact.
Okay, I'd like to check for the sternum.
The sternum is intact.
Check the chest.
Ribs are intact.
Ribs are intact. I'll just full pelvis and check for the abdominal.
Abdomen, no swelling, no tenderness, no swelling, no tenderness, no swelling.
I'd like to move to her pelvic.
Pelvic is intact.
Pelvic is intact.
Yes.
I'll move on to, do I see any obvious signs of bleeding?
No signs of bleeding.
Okay, on the 1%. Okay.
Now there's swelling at the around the patella.
Around the patella.
Yes.
There is
And
swelling.
you can get some crepitations.
Crepitations of the patella.
Yes, on palpation.
And palpation.
On palpation.
I'd like to splint my patient. I'd like first to check the sensory and motor before I splint. Pulse.
Pulse is present.
Could you go for me at all?
She can do that.
And do you feel that? I've secured her splint. I'd like to continue with my rapid assessment.
Go ahead.
I'd like to check her pulse.
Pulse is present.
Sensory.
Sensor is okay.
Could you go my test?
She can do that.
Okay. I've done the rapid assessment. Since my patient is unconscious, is there any relative who can answer some history?
We don't have any relative.
No relative. Okay, I'd like to proceed to secure her C-collar. I've secured the spine, the C-collar. And now I'd like to prioritize my patient.
Okay.
I'd like to check for the continuity of her spine.
The spine is intact.
Spine is intact, and I'll do a swab. Any bleeding?
No bleeding.
Okay, on your count, 3, 2, 1. I'd like to straighten the patient on the spine board. On your count, 3, 2, 1. On your count, 3, 2, 1. Let me check if she's reached her end. She has. Let's cover my patient again.
The patient breathing has changed. Your patient is having a chain stroke breathing.
Chain stroke breathing.
Yes, he started to vomit, projectile vomiting.
The patient has started vomiting.
Yes.
I'd like to, I've already secured her to the spine board.
Yes.
So I'd like to turn her with the whole spine. So she cut to the side.
Okay. Patient is turned.
Has the vomit all drained out?
Yes.
Okay, I'll return her back to her normal position. And I'd like to assess her RR.
The RR on a full minute is at 26.
26. It's remained the same from the last time.
Yes.
And her SpO2 now, since I'm in the vehicle?
SpO2 is at 95.
95.
Yes.
I'll continue the same level of, it was 12 liters per minute. I'll continue that, and I'd like to check her BP.
Okay. Why do you have a chain stroke? Why is the SpO2 okay, and why do you have a problem with her breathing?
It's because she had drowned. I might have startled her a bit, causing it, and also the temperature.
Okay.
What is her current temperature?
Temperature is at 32.5.
I'd like to continue covering her with this. I'd like to move now to my secondary assessment.
Go ahead.
I'd like to check her pupil reactivity.
The pupils are equal and reactive to light.
And check if there's any fluid coming out from
No
her
fluids.
head.
No fluids.
Nose
No fluids.
and her mouth. I'd like to check her if there's any visible jugular veins.
No GVD.
And the trachea.
Trachea is intact.
Trachea is intact. I'd like to move to her chest. And now auscultate her chest.
Clear breath sounds. Clear breath sounds. Clear breath sounds. Clear breath sound.
I'm looking at her chest. Is there any deformities?
No deformities of the chest.
Lacerations?
No lacerations.
Okay. I'd like to percuss her abdomen. Her abdomen.
Normal. Normal sound. Normal sound. Normal sound.
Do I see any laceration?
No laceration. The abdomen is a bit distended.
The abdomen is distended.
Yes, but not too much.
Not too much?
Yeah.
I'd like to investigate why it's distended. I'd like to hear.
Got some abnormal bowel sounds. Abnormal bowel sounds. Abnormal bowel sounds. Abnormal bowel sound.
So, since it's standard, what's her BP?
The BP currently is at 94/80.
So, I'll suspect that her bowel is distended because there's some fluid leaking in. So, I'd like to start an IV line and give her fluids and normal saline. Yeah.
Pelvic is intact.
my just. I like to skip this region and continue to check if there's any pulse.
Pulse is present.
Pulse is present, and I like to reassess sensory.
Sensory is okay.
And could you go my toes for me? Okay. It's okay. Sorry.
Sensory is good.
Pulse.
Pulse is present.
And could you go let us?
You can do that. The patient is vomiting again.
Vomiting? Since we're already in this ambulance, I'd like to sanction her.
After sanctioning, it's now clear. Why is your patient having projectile vomiting?
She had a brain injury. She was injured. I stopped the bleeding. Yes, so it's mostly due to that.
Okay.
Yeah. I finished my secondary assessment on her upper extremities.
It's okay.
And I reassessed her leg and her head. Okay, so I've done my reassessment.
So you're done?
Yes.
Okay.
Pardon?
Yes, thank you for watching. Kindly subscribe for more videos. See you next time.